Is there a threshold, do you think, as it relates to a business size where they really need to bring HR in-house?
I would say as soon as you have to deal with leave management, you need somebody with an HR skill set. But usually around 50, definitely once you hit 100. I have some that on a Friday afternoon will call me and say, I closed on a practice yesterday and I'm meeting the team on Monday. What do I need to know? HR was really an office manager or a project manager and doesn't really know HR. And so they're getting stuck with the function, but they're not really qualified for it.
Welcome back to the Dental Economist Show. I'm your host, Mike Huffaker. Before we dive into today's conversation, just a friendly reminder, if you're enjoying the show, please like, subscribe, or leave a review wherever you consume your podcasts. Your support helps us continue to bring valuable insights to dental professionals everywhere. Today, I'm very excited to welcome Kara Kelley, founder and CEO of Clinical HR, a human resources advisory firm dedicated to dental and medical practices. Kara works with dental practice leaders across the country to design strategic HR systems that support growth, engage teams, and strengthen culture. She specializes in leadership development, employee relations, and building competitive total rewards programs that help practices attract and retain top talent. She is also the co-host of the Compliant AF podcast. Great name. Kara, it's great to have you on the show today. How are you doing?
That's great to be here. I'm honored to be here. This is amazing. I've been listening to y'all for a couple of years and really excited.
Yeah, absolutely. Well, thank you very much. We appreciate you listening. So let's start with this question. What does HR actually mean in a dental practice or organization? And what do people think that it means?
What they think it means is more rules and reasons why they can't do what they want to do with their practice. I've literally this last week had somebody said that to me. Why can't I just do what I want to do with my practice?
Right.
What it really is, though, is it's supposed to support the human side. I like to say I advocate for the business. I don't necessarily advocate for the employees. I don't necessarily advocate for the doctors. I advocate for the business. And so sometimes that means I have to have a hard conversation with the practice owner. Sometimes it means we have to have a hard conversation about a team member. But that's really who HR is supposed to support, is the practice, whether you like it or not. We're there to keep you protected.
Yes. Well, let's take a step back. How did you end up where you're at today? How did you get into the dental space? How did you get into HR? Was this always a dream of yours from when you were a young child? You were thinking about, starting an HR business? Kind of walk us through the journey a little bit here.
Every little girl grows up dreaming of being an HR consultant, 100%.
Yes, yes. I imagine that was probably the case.
I like to say I landed here through serendipity and adaptability, both in HR and in dentistry, because HR, I actually was completely in a different field, self-employed. I was a clinical massage therapist. And when I was going back to school, I wanted to do something that, could transfer out to other types of businesses or things that could be more, give me more longevity than going to like PT school. So I decided to go to school for marketing. And I took an HR class as a general business credit and fell in love with it and switched my major. I have a business degree with a concentration in human resource management. And my last year or so of school, because I had been self-employed for so long, and this was 2012, and we didn't just hire the first person who showed up on time and sober in 2012. We actually looked at the resume. I needed to have something more than self-employment at that time, and from what I understood. So I was looking for a job somewhere, doing something that I could, do for a year or two while I finished my degree, and then go work in some Fortune 500 company HR department. And yeah, that didn't happen because I landed at a dental CPA firm. And so that's kind of how I fell into working with dentists, by doing marketing of all things for the dental CPA firm while finishing my HR degree. And I was there for about 7.5 years. I spent time as their marketing person, as well as office manager for a while, and then internal HR, and then started advising clients on HR. And kind of my last title was HR and business development consultant. Was just a catch-all for all the things.
You get to wear a lot of hats there. Sounds
like every small business, dentists know that, right?
Yep, absolutely. What do you think are some of the unique challenges in dentistry as it pertains to HR and human resources?
I think we don't have the opportunities that maybe other industries or other professions do when it comes to things like benefits, when it comes to leading our people. We've got the dentist who, in a solo practice at least, is likely still involved in patient care. So they're back in the chair. They're not really able to have a lot of oversight every single minute of the day, which is fine. We don't need to micromanage, but that isn't necessarily the same as some other fields that you might work in. I also think that we're limited on some of the things that we can provide as far as benefits. We can't just have our hygienist be a remote employee. Can't just have our dental assistant decide that they're going to show up at 10:30 a.m. with their Starbucks. We need people there. We can't be as flexible with schedules. We've got patients,
right?
Hopefully in a healthy practice, we've got patients booked out 6 months, right?
Yep.
And so we have a little bit of a limitation of what we can provide. And so that's kind of where I like to focus with the clients that I work with about building practices worth working for, building cultures that make those things seem like they're not a big deal, because we want to be there to work.
Right. Well, over the past few years, really ever since COVID, hiring, staffing has become an enormous challenge for dental practices, no matter the size, from independent practices all the way to the large DSOs. And you hear about it all the time, whether it's front desk staff or it's hygiene, clinical. It's been difficult. And it's a question I often ask on the podcast is, how do you differentiate yourself as an employer when there aren't as many levers to pull? Like you just explained, you can't offer all this flexibility that you might be able to get elsewhere. So what are some of the keys from your perspective that you see the most successful practices that are still able to hire and retain their talent? What are they doing?
They're building practices that not only do people want to work in, but they are raving fans of. They are building practices that your clinical team are like, oh my gosh, I've got the best boss. You should come work here. Hey, we've got an opening here. Our hygienist just left. We've got somebody to come work for us. We're building practices that have team members that are truly raving fans for our practice, not just, bringing in patients for us, but really bringing in other team members, because team members talk, whether you're office managers or admin or billing coordinators, treatment coordinators, they all have their little communities and they talk about how amazing their work is. And they also talk about how much they hate their jobs. So those are the practices. If you're building something that those people are going out and saying, I really don't want to be where I'm at, is anybody hiring? Those people that they're talking to are not going to want to come work for you either. I'm sure you've noticed, a very small, large community in dentistry.
Yes. Absolutely.
And so trying to focus on that, and like the actual technical of how we're doing that, I think a lot of practices that think outside the dental box, when it comes to how we manage things and how we do things from the people side, are the ones that are going to be more successful. And whether that's having some more flexibility when it comes to things like paid time off, whether it's a mindset with the leadership, whether it's the amount that they're investing in training. It's not always about high level benefits. I was just talking to a chief people officer for a larger DSO in like 17 states or so, with quite a few locations. And they flat out said, we're not top of the line when it comes to health insurance. We've had to pull back on that a little bit. We're not top of the pay scale. We are somewhere maybe a little bit above average, in the market value for the areas that we serve. But what we do is we create some flexibility with the team as much as we possibly can. We do make it a place where we are internally recruiting. We ask our team members, who do you know that might want to work here? And they were talking about their retention numbers, about how long people stay whenever they're referred to work there versus whenever you're just outsourcing from Indeed or wherever else. And I loved that they were bringing that up as a solution, because everyone thinks, oh, these big corporate practices have just got this bottomless pit of money to work for, whenever it comes to benefits. And there's no way we compete with that. It's like, well, actually, that's not true.
Right. Yeah. When you look at kind of folks' motivations or where they find satisfaction and fulfillment in their jobs, how do you rank things there? Obviously money is important. We know that. You have to be able to make a living, support your family, pay your bills, do those things. And I think in some other industries, and we run a software company, I run a revenue team, I have lots of sales reps. It would be disconcerting if a lot of the sales reps that I hired were not money motivated. But in other industries and spaces, I do think that like the hierarchy of motivations changes a little bit. What do you view as some of like the most important kind of like singular items that folks are really looking for?
Oh, I love that question. My response to that, when you ask like, how would you rank it? I wouldn't. They would. Ask your team what's important to them, because everybody's going to be a little bit different. And ask your team repeatedly, because I don't mean every day, but like what motivated them when they hired on may not be the same thing that motivates them 2 years later. You have other elements of something called the psychological contract. You have other elements of that science behind motivation that isn't just money driven. You know, some people are achievement driven. Some people are authority driven. They want to have some opportunity to move up the ladder, which again is a little unique in dentistry where there's a limit to where that ladder goes. Your assistant can't just wake up the next day and decide, hey, I want to go train to be an associate. You know, they have to go to school for that, right? Your front desk team member can't just decide to be a hygienist today. He has to go to school for that. So there's a limit to where that ladder goes in dentistry. And so sometimes we have to think outside the box on this as well, and create some other development opportunities, because that's what individuals crave, is they want to be able to achieve. Sometimes it's things that sound really simple, but stability. The number of practices that will do things like, our patient's canceled for the afternoon, so I'm going to send some of my team members home early to save on payroll. Okay, well, that means they're getting a pay cut, and they need that stability of getting the hours that they were told that they were going to get when they hire on. But so many practices, corporate or otherwise, will do things like that to save a couple dollars. And in reality, what they're doing is they're making their team member feel like they are not respected or appreciated, and they're not holding up their end of the bargain from the practice owner side. And so finding a location that's going to be stable, that's going to say, okay, look, we hired you for 36 hours a week, and we're going to guarantee you get 36 hours a week, or at least have the opportunity to get that, is going to be motivating to some people, especially someone who might be in a kind of a financial situation where maybe there's a divorce, or spouses in sales where they're commission based and they have a little bit up and down. You know, there's things like that create that stability financially, emotionally, otherwise, for the team members that can be more motivating than money in some cases.
Yeah, you spoke a little bit earlier. You mentioned that the available opportunities in different dental practices may be somewhat capped. And in a lot of industries and spaces, there's a kind of a big focus on career pathing and ensuring that you have the opportunity to present multiple paths for individuals to continue to grow. I understand that it's hard in a independent practice. When you start to look at emerging groups and growing groups, do they have a benefit in how they are able to attract talent, because there could be more potential growth plans when you start to scale?
Yes, and there's still a limit to how many regional directors they can have, and how many directors of ops and CFOs and whatnot that they can have. But they do have more opportunity just simply because there are more positions. So you may have somebody who's a practice manager that really may be interested in finance, and your CFO needs somebody to, do some work, and maybe they've got a background that would support that. And it sounds like, well, nobody's going to want to be a practice manager and then go, work in the accounting department. Maybe they do. Maybe you should ask them that, and think outside of that, like I said, dental box, on what are some other opportunities you can create, or at least make the offer to create it. Maybe they don't want to do it. That's fine. But you're saying, hey, I see you and I support you, and here's an opportunity that's presented itself and I'm considering you for it, and try to drive some internal promotion. So yeah, absolutely. Whenever you have more positions, you've got more opportunity for that. We just have to stop thinking so limited in terms of, well, they're clinical, so they can't do this, or they are working at the practice level, so they can't do that.
For somebody that's ambitious, that works at an independent practice, and they love the industry, they love dental, and maybe they're happy where they're at today, but they have aspirations for in the future, maybe working for a larger organization, or moving to the vendor side, or something. What are some of the pieces of advice that you would give them that would help them both in their professional growth and also kind of align with their ambitions, so that they could set themselves up as best as possible for future opportunities?
So I actually have a worksheet called an alignment and accountability check-in. It's something of a performance review, if you want to call it that. But I like the alignment and accountability check-in. And I'm happy to share with you a link to that if you want to drop it in the show notes for anybody that's listening to this. Free resource, welcome to it.
Sure. Yeah.
Modify it however y'all want. But I literally asked them, what is the one thing that they think would move them forward in their career? And how would that align with what the practice goals are? How would that align with what their role is right now? And actually have them think through, have them be the person that comes up with, what do you want to do? We're interested enough in you, and we care enough about you to ask the question, what it is you want to do with your career. And then as long as you can tie that somehow to practice alignment and your role, or something that's going to benefit the practice, then how can we best support you with that? Ask questions like, what are your barriers to this? How can we remove these obstacles for you? And so I think that, if you're talking about the individual level, there may be some opportunity where they need to talk with a career coach. Maybe that's something in some of the larger groups that you could bring in either fractionally or have somebody who is part of your learning and development team, if you have internal trainers, that they can do some one-on-one career coaching with the individuals. And I don't mean just sending out a survey occasionally, but like actually have some, okay, this is where you are, this is where you want to be, not just based on, I want a bigger paycheck, but what do you really want to do? And how can we help you get there while still tying that to practice goals?
Yeah, absolutely. So you were talking about, HR protecting the business or serving the business, which can be all elements, all aspects of a practice itself. And sometimes it can be an individual employee, and sometimes it's the overall health of the organization and compliance and protecting against liability. What are some of the things that you see that people need to look out for in order to protect their business? Like, what are some of the risks that are frequently coming up that could cause challenges in either the business continuity or from a liability perspective or lawsuits, kind of maybe some of the or financial, like some of the not pretty stuff that people should be aware of?
A lot of it is going to deal, especially when you're dealing with group practices, with multi-state compliance. I have worked with some practices in the past that are like, oh, well, we've got a practice in California, so we just follow California's laws and we're good. No, you're not, depending on where you're at. There's plenty of other states that have things that are different than what California has, for example. We like to say that that's the most complicated state, and it's certainly up there. I don't know if there's one over another.
It's pretty complicated.
It's pretty complicated. It's pretty up there, but it doesn't mean that if you do everything California says that you're automatically in the clear for every other state. That might have been the case at one point, but it's not the case now. So there's a lot of multi-state compliance. I think a lot of it too is just not having the right people on your executive team, not having the right advisors. I literally was having a conversation with a doctor earlier today where they took advice from their business coach about dealing with an employee who was on maternity leave and wanted to work remotely. And they had given one answer at first, and the business coach came back with something else, did not caveat that with, and by the way, check your state laws. And this was in a state that has some expansion of Americans with Disabilities Act at the federal level. And so it did apply to them. And it was something that they needed to be very, very aware of how they spoke to this team member. And the business coach, I'm sure with all good intentions, but didn't say, oh, by the way, you probably should say, this or not say this, or check with your attorney or HR or somebody. And what has transpired since then definitely has some risk. And this is not the first time I've seen it. I've seen this several times, especially dealing with disabilities. I think one of the biggest issues with that, even in larger groups that have internal HR, is that we're not actually training our boots on the ground people. We're not training our practice administrator or our office managers who are like that first line of defense when it comes to dealing with the clinical team or our call center managers. We're not training those people on what they should be looking for. What are the red flags? This is company policy, but also you should be aware this is company policy for this reason. And this can get us in trouble if we don't do X, Y, Z. So I think a lot of it comes from just lack of awareness at all levels.
Yeah, I think people think that having good intent or best intent kind of covers you, but it doesn't. And it can still get you in quite a bit of trouble if you're not understanding what the rules and regulations are to stay compliant.
Intention does matter in some cases, but also ignorance is not an excuse for the IRS, Department of Labor, or EEOC. So we should probably make people more aware of what applies to your specific practice.
Yeah. When do people start thinking about formalizing their HR processes? Is it something that at the independent practice level is common, or does it become an afterthought? I would imagine that once you start growing practices, you start to have more of a recognition of the importance of the function. But how do you view that? Is that the case? Are there still groups that are in the dozen plus location bucket that don't have HR all buttoned up, and if they don't, like what type of liability is that exposing them to?
The answer to most of those questions is yes, just all the way around. Yes, I have some single doctor practices, single location practices that go about it the right way. And a couple months before they start or buy the practice, they are reaching out and saying, hey, I want to I want to start this off on a clean slate. I want to make sure that we have an employee handbook in place. I want to make sure that we've got offer letters, that I'm doing this correctly, that I'm sourcing correctly, that I know what I need to know to be an employer. I so love working with those clients. Those are my favorite doctors, really. Yep. I also have the ones that, like you mentioned, as an afterthought. I have some that on a Friday afternoon will call me and say, I closed on a practice yesterday and I'm meeting the team on Monday. What do I need to know? And I'm like, oh, okay. So then we have to kind of pick our battles of like, okay, these are the things you have to do right now. And here's the things we need to immediately start working on. And then I have some that I've talked to that are 10 location practices with no employee handbook, that are 20 location practices that have HR, but HR was really an office manager or a project manager and doesn't really know HR. And so they're getting stuck with the function, but they're not really qualified for it. They may be amazing, all good intentions. They may be a great leader, and they don't have the compliance background, or they don't really understand the functions of HR. And so all of the above. And yes.
Yeah. So what are the risks there? The risks are, I mean, obviously from a hiring and retention perspective, but from a compliance and everything, lay out some of like the worst case scenarios, things that could occur if somebody is not properly putting in place the handbook and the processes and all of these things that you're speaking about.
Audits, lawsuits, fines, and penalties.
Okay.
To succinctly say it, honestly, it really depends on where you're at, of course, and what size you are. But I mean, audits can be random. Audits can be triggered by somebody reporting something to the state, to the Department of Labor, because we decided, oh, well, we don't want people to keep timesheets. We're just going to have them clock it or ignore the time keeping system, and we're just going to have them all be paid salary. It's totally fine until somebody's working overtime, and then they go to report that to the State Department of Labor, and you end up with an audit. You can end up with discrimination claims because, well, it's my practice. I don't have to keep them if I don't want to keep them. We're an at-will state. We can do whatever we want. Nope, that's not true either. Right. You have those types of issues that we're refusing to accommodate when we're required to. You have issues with things like documentation. I-9s are one that I see pretty frequently that, oh yeah, our payroll company is taking care of that. No, they're not. They might be collecting the information from the employee, but you still have to do your employer portion, and you have to do it within a certain period of time. And if you're doing things like working interviews, which I'm so not a fan of, but if you're doing things like working interviews, then by the time you actually get around to hiring them, you're already past that window. So there's a lot of those little compliance documentation things that come up if we're not really paying attention. Every state's going to have a variance when you deal with things like, for example, background checks. If there's certain points in the process that you can conduct a background check or can ask about criminal history. And some states and even some cities within some states or some counties within some states might have a variance on that you could get yourself in trouble if you're not doing that properly. So all of those are just a couple of high-level things that I see are common mistakes. And a lot of this comes, I think, from people getting advice on social media, getting advice from a friend, that they think, oh yeah, this person's doing it. This is totally fine. We can make a policy that says that they're not allowed to discuss their pay and we'll fire them for it. We're an at-will state. Nope, can't do that either. and they don't just have anybody to tell them, oh, by the way, this is not accurate. And so I think that's some of the just really low-hanging fruit of issues that I tend to see that are compliance related, not necessarily culture related. Like you mentioned, that there's definitely that as well.
Tell me a little bit more about these working interviews. I'm actually not familiar with this in the dental space. So what is a working interview? How do they structure them, and why are you not a fan?
Working interviews is where they basically have somebody come in and fill in as an employee for the day. And they just cut them a check at the end of the day if they pay them at all. From what I have seen, this is news. You've not heard this one, really?
No, this is new. This is new for me. Yeah, this is out of the realm of what we would do in our space, that it's like a foreign concept almost.
Yeah. It's some industries do some things. Like you might see it in the restaurant industry where a chef comes in and effectively auditions by making a dish. But whenever somebody is doing productive work that's actually taking the place of another employee, they are working. They are supposed to be a W-2 employee on payroll, just like when you bring a temp in, which is a whole other conversation of things that happen that are not correct. But when you're doing this working interview and you have someone come in, I get that you're trying to see how they work with the team, but there's a couple of different reasons why it's a problem. First of all, it's going to be your wage and hour issues where they're not getting paid properly. You're not taking taxes out. There's a huge misconception that goes around on social media where I'll see somebody saying, well, they made less than $600 and so we don't have to make them a W-2. I'm like, that has nothing to do with this. That's the $600 threshold for 1099ing an independent contractor. This person's not an independent contractor. They're actually performing work. So you have wage and hour as an issue. You may have break laws that could be an issue as well. You could have liability from workers' comp if they get injured. You can have liability for your general liability or your malpractice if they injure a patient while they're doing this. You have potential HIPAA violations if they don't sign a BAA and if you're not doing any training for them. There's a whole slew of just compliance issues there. The biggest one that I see that's an issue, though, is that it doesn't actually tell you if this person really knows how to do the job. I had a client several years ago that was hiring an orthodontic assistant who was supposed to be the lead assistant. And so they came in, had her do a working interview. And 2 weeks after they decided to hire her, they found out she didn't know how to take an impression. And they're like, she came in, she did a working interview. How do we not know that she didn't know how to take an impression? Because you didn't actually test her skills. You just stuck her in there in rotation. And anytime an impression came up, she had another assistant do it. And so you didn't actually learn what you needed to learn. So to me, working interviews don't really work. They don't really tell you what you need to know. And you're also putting somebody who is just kind of a trial run, guinea pigging your patients there. You want to have somebody do a working interview at your front desk. What happens when a new patient calls and this person has no idea anything about the practice, has had no training? That's really what you want? Okay, that's a choice. What I would prefer to see instead is something that's more of a skills assessment. You want to check somebody who's an administrative team member or potential candidate for administrative team member. Give them a script, train them on how you want the phone answered, have them do it for you, change something up, see how they adjust. Have another employee call in for a mock patient call, things like that you can actually test what you're trying to test. Redact an EOB and have them read it to you. Have them try to, go through your software on your training account or your dummy account or a fake account, whatever, and book a patient. Those are the types of things that you can do to actually test their skills, soft skills as well as technical skills, because you can test what happens when they run into a problem. Do they immediately drop things and turn around and ask you for help? Did they ask another team member? Did they Google it? Did they put all the patient information into ChatGPT and have it spit back out something? What are they doing when they get stuck? Look for those things. That's going to tell you more than throwing them into the rotation to work for the day.
So clinical HR, it provides fractional services that for practices and groups that don't have their own internal HR. Do you also occasionally work with groups that do have their own internal HR function, and what does that engagement typically look like? Where are you closing gaps, and where do you fit in that scenario?
I do. I work as a what I call fractional HR business partner, where I will come in and I will interview the HR team members. I will kind of assess what they're doing from the compliance standpoint and see if there are any gaps. I may be asked to come in to assess an HR manager's readiness to be an HR director. I may come in and look and kind of see what their processes look like, or what are they doing. And sometimes that shakes out all kinds of things. I did one last year where they were auto deducting meal breaks for lots of states, including California, which if you know anything about California, you know that's a big no-no. It's no-no at the federal level, but really not in California. So things like that kind of come out that nobody was really paying attention to or didn't know that the HR department didn't know what they were doing. They'd also overhired on their HR department. And so we had to make some changes there. And that's not my goal when I go into any of these HR departments, or if it may be a department of one, that's what we call it in HR, the DOO. Mm-hmm. When I'm working with this HR person, I'm not intending to come in with the idea of tearing everything up and getting everyone fired. I get asked that question sometimes, but HR doesn't always like firing people. If you do, you probably shouldn't work with HR.
I was about to say, it sounds like you're fulfilling the Office Space role a little bit. Come in, the consultants come in and say, "What do you do here exactly?" Not quite like that, I imagine.
It is not quite like that, although that sometimes has to be my role, and it sucks. It's not the fun part of the job. I don't enjoy it. And I've had to participate in some terminations that I didn't agree with or I felt was terrible timing. I've had to do, January 2nd terminations for somebody who had been told they were getting a bonus in January, and all of a sudden they were getting terminated as soon as we came back after New Year's Day. Literally first thing I did that morning. Yeah. I've had to terminate someone that was there for a month that was not really hired well. Like they had overestimated who they needed. They didn't really have a function for this person, but this person was only there 20 hours a week. And at the time that equated to less than $1,000 a month. I'm like, could we really not, she turned down other opportunities to come work here. Could we really not find, okay, all right. It's not, I advocate for the business at the end of the day. It's not my decision to do it, but I took care of it. That is kind of the role that I have. I've had to actually fire HR people for DSOs before because the business owner didn't want to do it, was afraid they were going to put their foot in their mouth, and the attorney couldn't do it because they wanted to be able to litigate. And so they needed to have somebody who was an impartial third party come in and actually do it. So basically it was me showing up on a Zoom, reading a script written by the attorney in my voice, but 5-minute conversation to fire the HR manager. I unfortunately have to participate in that.
I would say a red flag is anyone that takes pleasure in parting ways and doing terminations. We've all had to do them, had to do many, many of them over my career, and none of them are pleasurable experiences. And if you don't have the empathy, at least to put yourself in the other person's shoes a little bit and realize how terrible of an experience it is for them as well, I feel like that's maybe a bit of a red flag there, because it's tough. It's necessary.
It shouldn't be the best part of your day.
Should not be the best part of your day. No, absolutely not.
I'll also say, though, it takes a certain kind of person, and it takes a certain skill set to be able to have that conversation and not break down, because sometimes those terminations are very heart-wrenching. Like you said, have empathy, but also you can't be the one crying. And I've had to deal with that manager before too. The other side of it is the terminations where they say something that makes you want to take it back. And you have to be able to hold firm with that process and say, we are terminating for this reason. We already have the documentation in place. Regardless of what they say, we can't change our mind. We've already cleared this with legal. Like, we can't just change our mind just because somebody pulled our heartstrings. It sucks, but we have to do it.
Yeah. What is there a threshold, do you think, as it relates to a business size where they really need to bring HR in-house? And how do you think about that and help people make that decision to understand when it is that time?
I would say as soon as you have to deal with leave management, you need somebody with an HR skill set. So that, depending on the size of your business, could look like if FMLA applies. If you're in a state that doesn't have something, an additional leave that expands FMLA, Family Medical Leave Act, that's 50 employees within a 75-mile radius at the federal level. So when you're there, when it starts to apply, you have leave management, that I think is a good time to start bringing somebody on. I also think it kind of depends, like, how many locations do you have? If you're going to have a centralized HR versus trying to control things within various hubs regionally or at the practice level, you may need the HR for that to kind of help those leaders manage that. But usually around 50, definitely once you hit 100, when you've got EEO-1 reporting, I would say that would be the time to certainly bring in HR. And you may not need to bring in a full-time HR person, an HR manager. You might be able to deal with fractional or a part-time HR generalist, or maybe you bring an in-house recruiter in so that you could also work with a fractional for some of the other things. And you maybe have some of those functions land within finance, like payroll. Your CFO handles that. You may have your COO doing certain things like, the onboarding or the hiring, or somebody on their team. It may be not them directly, but someone on their team internally that you can kind of piece out those things. But HR is a much bigger function than a lot of practices give it credit for. You are dealing with the compliance, you're dealing with the employee relations, you've got the learning and development side, you have the recruiting and selection process. There is a lot more to it than just HR. We're doing paperwork and onboarding people.
Yeah, I mean, when you talk about the DOO or Department of One, like that individual has to wear so many different hats within that function. You talked about maybe still working with fractional, working with consultants. What are the HR specialties that people should consider when they're ready to branch beyond just having a generalist director of HR that's within their organization? I think you just touched on them, but kind of go into maybe a little bit more detail about the value that each of those provides.
Recruiting is definitely one of the first ones that I'll see practices expand to. If they might have a dedicated HR individual, but that's one of those things that can take a lot of focus and it pulls from a lot of focus. So that I think is probably one of the first steps, is especially if you get to a level where you are having a pretty consistent recruiting cycle. It's not like a one-off that occasionally we need to hire somebody. We're constantly having to hire someone. That's another position. It could be internal, it could be external, but that's really another position. And if you try to have that on your DOO, your Department of One for HR, or your Director of Ops, or your practice administrator, whatever you call it, that's going to pull their focus, because that's a lot of sourcing candidates. It's a lot of drafting job descriptions. It's a lot of coordinating with the practice leaders, who are at the clinic level, of what do you really need for this position? How much experience do we need for it? It's a lot of talking to candidates. It's interviewing. It's all of those things. It's background checks. Like, that pulls your focus a lot versus somebody who is doing something like what I do, when internal investigations or employee handbooks or something that is, more a little deep focus work. It's definitely one that I see be kind of the first position that they outsource. Past that, somebody who's coming on to manage really the compliance side. Most most practices at a certain level are going to have their director of compliance or their compliance officer. So making sure like all of the certifications are up to date and where they're supposed to be, making sure everyone's got the CE that they're supposed to and following up on the training. That could shift into what we'd call learning and development position, depending on the structure, but that could be another one. I also see some internals that you might get an HR assistant who's either helping with payroll or helping with onboarding. If you start getting big enough to start building out a large enough HR department, and it's not just one person, those are some kind of like I don't want to say lower level, but more of the specialist roles where you've got someone who's a benefits coordinator, maybe somebody who's the payroll coordinator who works with finance, and then maybe someone who only onboards people. And they, that's the thing that they do is they bring on people and make sure that they're the culture champion for whenever someone's brand new to the organization. I think it can kind of continue to spread from there once you get really, really large. But that's outside of the scope that I typically work with, because hopefully at that point they have someone who's a CHRO, a chief HR officer level, or chief people officer that can really help drive that.
We talked about a lot of the do's at the beginning of the conversation and the importance of building a strong culture and creating an environment where you can bring in referrals, where your team members want to refer other people to work there, where it becomes a place that people enjoy waking up and going to in the mornings. What are the don'ts? Like when you think about things that kill culture and practices that don't have that become toxic, where somebody wakes up every morning and goes, I don't want to go to work today. It's the last thing I want to do. What have they done to create that environment? What are the behaviors that you see, the actions, and what's missing?
A lot of it will stem from inconsistently applied policies, tolerating behavior from one and not from someone else. And like, why are they getting special treatment? Why are they allowed to come in every single day, 15 minutes late, and I get in trouble whenever I'm a minute and a half late? Things like that I feel like can really create that negative impact for somebody. Not listening, not having a loop for feedback, if you want to call it that, feedback, feed forward, whatever buzzword we want to use today. But having some kind of a loop where people feel like they're heard and seen and listened to and respected, that's a huge part of it as well. Not focusing on training your leaders for leadership. They may be clinically proficient and amazing. They may be like the top person when it comes to billing, and they've got all of the ARs at like negative at this point because they are just so great at their job, and that's the practice administrator that you absolutely want to have. And they're not the best leader or they don't know how to communicate with people. And so investing in training your leaders for leadership at the practice level as well as at the corporate level, if you get to that point. And some of it's honestly a very, very beginning first impression that we just don't focus on. We say, oh, okay, we've offered someone the job and we've sent them the intro packet, and they'll show up on day one and they fill out some paperwork and then they get thrown right into the rotation. And there's never an opportunity to onboard them, which I like to define onboarding versus training. Training is training them the technical, communicating the skills that they need to have and the processes and policies and procedures that we have. And this is how we do things here. Onboarding is let's integrate them into our culture. Let's go ahead and spend a couple of days letting them shadow the position that they're supposed to be in. Let's not just automatically be so desperate that we need them to work right now and we don't have the opportunity to really integrate them into the culture here and show them the way that we do things here. How do we talk to patients?
Make them work before they start their job.
Or that, yes. The ones that I see that are like, we're going to send them 3 hours worth of paperwork and employee handbooks and training documents before they start on day one. First of all, it's a compliance issue. And second, is not the best first impression that you want to give.
No.
You want to send them something that makes them feel like part of the team. Send them a swag box to where they can show up on day one with the company t-shirt and the Yeti mug and the notebook and the pen that's all branded, and send something around to the team that's there that says, here's our new team member. This is what you need to know about her, so that on day one, this person shows up and they're like, oh, hey, hi, Amanda. Welcome to the team. We're so glad you're here. Can't wait to get started. Versus sitting them in a corner during morning huddle and say, hang on a second, we'll talk to you later. We're going to do this and get started. And then you can meet me in the office. Like, onboarding starts at as soon as they accept the offer, not on day one.
Yeah, I would imagine that onboarding them to employees is a weakness for a lot of practices.
Probably. And that's why we end up with employees who come and show up for a week and a half and then ghost, or who don't make it past that 90-day period. They didn't really get that onboard experience. They didn't get excited about working here. You'll hear the stories of they never even showed up for day one. They accepted the offer and then they ghosted. We didn't hear from them. What did you do between the time they accepted the offer and the time they showed up? Did you reach out to them at all? Did you get them excited and motivated to come work here?
All right, Kara, where do you go to learn? How do you stay on top of all things dental, or just from a professional and personal growth perspective?
For myself personally, I have 3 buckets. I have my HR world, my speaker world, and my dental world. And I go to conferences and training seminars for all of them. Sometimes I'm speaking at a dental conference, but I like to listen in to the people who are there. Sometimes I'm attending a webinar that maybe a friend might be speaking at, and I'm learning from them. In speaker world, I have National Speaker Association, which also I think really gives me a lot of good broad business advice, and it lets me connect with other professionals in other industries. And I say the same for HR world. I'm a senior certified with HRCI, which is HR Certification Institute, as well as through Society for Human Resource Management. So I am a SHRM SCP and an SPHR, which means I have to have 60 hours of continuing education every 3 years for each one of those. So I do spend a lot of time on my own personal development and professional development, learning through organizations like Littler, which is a law firm that does a lot of the legal and compliance education, through SHRM whenever they put on something that may be local, so I can go connect with people personally, and then just other webinars and things that I can find throughout the year, because I do try to stay on top of my own learning.
I like the framing of it in the multiple buckets. With the speaker one, what's the function of the National Speaker Organization? What does that do? What does involvement in that look like?
Oh, NSA, it's a professional association for speakers, podcasters, coaches, consultants, anybody that makes their living through the spoken word. We have a lot of authors that are there. It's not all just keynoters. You've got trainers, facilitators.
Asking for a friend. Just curious. Yeah.
No, absolutely. It's one of my favorite organizations. I've been in leadership at the local level, and I'm on chapter leadership committee at the national level, helping mentor other leaders of chapters. It's definitely been one of probably the best places that I've invested in my professional development.
Very cool. Well, last question. What makes you still bullish on the dental industry? What gets you excited? Why do you enjoy it so much?
They're my people. They really are. They're lifelong learners. They're slightly neurotic. This is stuff they don't learn in dental school, but a lot of them, despite the ego that you hear about doctors, a lot of them are humble enough to say, I don't know what I don't know. Please help me. And I love that. I love the compassion that they have for their patients. I have some amazing clients that have endless compassion for their team. I love working with those people that really just want to continue to serve the world and make it a better place. And that's just, they're my people.
Awesome. Kara, thank you so much for joining. Appreciate the conversation.
Thank you for having me. This was fun.
Absolutely. The Dental Economist Show is brought to you by Planet DDS. To find out more about how cloud-based dental software by Planet DDS helps unleash dentists and their staff to focus on patient care, visit www.planetdds.com. Stay tuned for upcoming episodes by following wherever you listen to podcasts. Thanks for listening.